Hi viewers, welcome back. So today we are going to discuss about the coarctation of aorta. So this is the fourth condition in which we are going to see uh, what is happening which is leading to acyanotic heart disease. Okay, so already we have discussed about the arterial septal defect, ventricular septal defect and the patent ductus arteriosus. So this is the final condition. So now what is happening in coarctation of aorta? So coarctation means it is the narrowing of the aorta. See, here you can see there is a narrowing of the aorta. So usually this narrowing can happen any place, okay, but particularly in many of the cases we can see it is above the, like, once there is an arching, that branching takes place, and below that arching only this constriction takes place. Okay, so most of the time this narrowing is after the coarctation, that is like after the arching of the aorta. So what is happening when there is a narrowing of the aorta? What happens? So there will be blood that is like pushed from the left ventricle to the aorta. Okay, so from the aorta it has to go to systemic circulation. But now, as because there is narrowing, what is happening? The blood is not getting perfused to the systemic circulation. So the blood is either it is getting stagnating, or otherwise the left ventricle is trying hard to push this blood into the aorta so that it reaches the systemic circulation. Okay, so this is the pathology you have to understand. There is narrowing of the aorta. As because there is narrowing of aorta, there is inadequate systemic circulation. So as because there is inadequate blood flow to the other organs, you are getting constant instruction. So what happens? The heart is working hard to push this blood to the aorta so that it will be perfused. But as because there is a narrowing, it is not able to pump the blood from the left atrium to the aorta for circulation. So you have to just remember this point. Okay, then we will discuss what is going to happen. So coming to these signs and symptoms, as because there is decreased perfusion, most of the time there is pale skin for the baby. So what happens? There is decreased perfusion and you are not able to see that pink color skin of the baby, or otherwise even the baby is not cyanosed. Okay, so the baby presents with the pale skin where there is decreased blood perfusion, where there is a cold and clammy extremities because there is inadequate circulation. Hypoxia will be present, and then irritability, as because the hypoxia is present, the child becomes irritable. Poor growth, poor sucking will be there, and poor growth or the failure to thrive happens. And then as because there is a narrowing in the aorta, what happens to blood pressure? You have to remember 2 points here. So one is the narrowing, like there is a narrowing area in the aorta. So whenever you see, the blood pressure will be high above this narrowing part and low below this part. Okay, so usually this narrowing area will be there. You are able to see this narrowing area. So what happens? The topmost area. So usually the child will present severe headache and there will be an increased blood pressure in the upper extremities. But what happens in the lower extremities and in the lower parts? There will be inadequate perfusion. So there will be a decreased blood flow and decreased blood pressure in the lower extremities. So the child presents with cold and clammy skin in the extremities. And when the child is having an increased blood pressure in the upper extremities, what will happen? The child will have severe headache also. In case if the child is grown up and if the child is able to verbalize, the child complains of headache. Okay, so you have to remember these are the signs and symptoms when we are coming to coarctation of aorta, followed by management. So management, what way we will be doing? First is your cardiac catheterization. Just you have to remember there is a narrowing of the aorta. So what we are going to do? You are going to remove that narrowing part. So what we are going to do? Similarly, like our cardiac catheterization, we are going to do, you are going to see for the femoral vein. make a small cut in that femoral vein, insert the cardiac catheter. Okay, so you will be inserting the catheter slowly into the blood vessel. It reaches the right atrium. From there it comes like same like that, like how the blood is flowing. Similarly it will come and it has to go and reach the aorta, and where the narrowing has taken place. So where the narrowing is there, either you will go and you will try to remove that narrow, or otherwise what you can do it, like you can go and you can fix up a balloon and you can inflate that balloon in that area. So you go and keep a balloon in that area and you can inflate that balloon, and that area will be wide open so that blood will be flowing easily. So that will be one procedure. So that is like that balloon inflation you can do, or otherwise it is like stent replacement. Stent you can fix. So instead of a balloon, you can just fix a small opening device or a stent. You will fix it up in that area. So what happens? So blood flow will go and take place easily. Okay, so you can place a stent device, or otherwise surgical closure with the patch. Okay, so either what you can do, so what you can do is like you can cut and you can remove that area, and with the nearby tissues you can close that area, and you can create a clear pathway in that area so that the blood is flowing easily. Okay, so these are the three corrections what you can do it with your coarctation of aorta. One is your like cardiac catheterization procedure with your balloon inflation you will be doing. The second is your stent placement you can do, and the third one is like you are going to cut and anastomosis that area with the neighboring tissues and arteries. Okay, so this will be a surgical correction. So with this we are completing our acyanotic heart disease, where in coarctation aorta what we have seen is the narrowing of the aorta. As there is narrowing of the aorta, blood pressure above the coarctation will be high and below the coarctation will be low. So usually upper extremities will have increased blood pressure, commonly presenting with children who are able to verbalize. They present with headache. In case if it is in the lower extremities, the blood pressure is going to be very low. Calm, like cold and clammy skin will be present, decreased blood pressure in the lower extremities, irritable child, and then failure to thrive, and what happens then, hypoxia will be present, pale skin will be present. All these will be the signs and symptoms. Followed by diagnosis, you have to diagnose with your x-rays and your echoes and your ECGs. And management, we have seen three management of your cardiac catheterization, stent placement with balloon inflation, or otherwise with your surgical repairing with your cutting and anastomosis can be done. Okay, so with this we finish our acyanotic heart disease, in which we have discussed the arterial septal defect, ventricular septal defect, patent ductus arteriosus, and coarctation of aorta. Okay, hope you understood the class. In case if you have any clarification, kindly give your comments in the comment box. Till we meet in the next class, take care, bye.